In September 2001, my son Spencer was born. We had him home from the hospital after normal pregnancy, and while he was at home, we noticed that he was having these episodes of spitting up. And so we kept taking him to the doctor. We were told that it was nothing to worry about. And then on one day at a friend's house, he actually choked and stopped breathing from what we now know was a reflux episode. He was rushed to the hospital where he was resuscitated, and we were sent to another hospital. This was just at our local regional hospital. Sent to a larger tertiary care hospital for further testing and more investigation into what had caused this respiratory arrest, basically, that Spencer had had. While we were at the hospital, we had been transferred, and when we arrived, we were seen by an attending pediatrician, and we were told that Spencer had aspirated some milk into his lungs, and that they would be doing further investigation. The doctor at that time suspected gastroesophageal reflux. Later that afternoon, we were sent for a test, a reflux test, and we were taken down with a porter. When we arrived down at the testing area, the lab technician was actually quite shocked that we had been sent down for a reflux test without resuscitation equipment, as this is a child who was obviously prone to aspirating from the reflux, and we were about to do a test that was going to cause reflux. So sort of a lack of a communication there. The lab technician phoned up to the ward, and the ward nurse actually wasn't even aware that we had left the ward to go for the test. So we waited, and a nurse eventually did come down with oxygen and resuscitation equipment and ambibag and that type of thing. The test was done, and during the test, I remember the technician exclaiming about how severe Spencer's reflux was, and that it was one of the worst cases he had ever seen. We were returned to the ward and sort of waited out the night, and the next morning we actually saw another attending physician. The physician that we had seen the day before, I guess, was no longer on call or just wasn't available to us, so we saw another attending physician. And he explained the gastroesophageal reflux to us and told us it was nothing to worry about. It was very common. Kids grow out of it, and there were just some very basic things that we needed to do to manage Spencer at home. Those included never laying him flat on his back, feeding smaller meals, just really simple, common sense type of management. So we were there again another night, and then the following morning we saw yet another attending pediatrician. The pediatrician we had seen the day before had left to go for 2 weeks holiday. So we saw this new pediatrician, and he had basically said that we could take Spencer home at any time. I, of course, was terrified because his episode of aspirating had been in the car seat. So I asked if we could do a car seat test before we left the hospital. And so that was agreed upon. The test was set up, and we fed Spencer, put him in the car seat. And at that time, I didn't know, but when the test was arranged, no resuscitation equipment was placed in Spencer's room. Here we were doing a test designed basically to make him aspirate, and we had no resuscitation equipment available in the room. There was no communication between the nursing staff, the doctors who had placed the orders. There was supposed to be an OT present, an occupational therapist was supposed to be present during the test as well. So we put Spencer in his car seat, and about 5 minutes later he started choking, and I could see that he was doing the same thing that he had done in his previous episode. So of course I'm freaking out. I look out at the nurse's desk, and there's a young medical intern standing at the desk. So, of course, I scream for her. She comes running in the room. There's no resuscitation equipment in the room. And rather than, I think, because she was scared, she didn't follow protocol and call a code blue, which is where there's a team that would come to resuscitate him. Instead, she lifted Spencer up in her arms, ran out of the ward with me chasing wildly behind her, down 2 flights of stairs, and rushed into the special care nursery and laid him on a bed there. And, of course, everyone came over, and he was once again resuscitated. He had actually gone into another full respiratory arrest. After they resuscitated him, I was hysterical and begged not to be sent back up to the ward. Sorry. But of course, we couldn't stay in the special care nursery. And they did have an isolation room there, but unfortunately there was another family using it. So we were sent back up to the pediatric ward. And again, no communication to the ward staff of what had actually happened. He was not given any one-to-one nursing. He was put back on a 3-to-1 nursing situation. And this is a child who's basically had 2 life-threatening incidents. So that night, my husband and I were quite adamant that, this was getting scary and we needed to get something done. And we saw yet another pediatrician that afternoon, and we were finally feeling like we were getting somewhere. He agreed with us that Spencer should be transferred to BC Children's, that there was more going on here than what they had originally suspected. And, here he's had 2 respiratory arrests, and we needed to get something done. And in the morning that we would be transferred to BC Children's Hospital. So somewhat at ease that night, we spent another night in the hospital, and the morning came, and yet another pediatrician. So we found out that the pediatrician that we had spoken to the day earlier, it was actually his last day of a locum at that hospital. And the new pediatrician that came on the next day felt that they wanted to do more investigation themselves before sending us to Children's. We weren't very happy about that, and didn't feel that we could communicate that, and didn't feel that our concerns were being taken seriously. That night, about 4 in the morning, I entrusted Spencer to the care of a nurse, excuse me, on the ward, and she didn't read the charting, and I guess hadn't heard the report from the other nurses, and laid Spencer flat on his back in the stroller, and he aspirated, but because nobody was watching him, he actually went into a full cardiac arrest. This time a code blue was called when they found him, but he was quite far gone. It took over 9 minutes of CPR to get his heart going again. When they finally did get his heart going again, the doctor came out and spoke to me and basically said that they had gotten him breathing again. And but he was not responding to light. He was not responding to pain, and they had to put him into a drug-induced coma to stop seizuring. And we were to be transferred to BC Children's Hospital, but not really in the way that we had hoped. So that night, the infant transport team came from Children's, and they took Spencer, intubated, fully intubated, and on a ventilator to the ICU at Children's. And we followed. But I think the underlying sort of messages here is that the lack of communication between the healthcare providers during that week we were there led to this tragic, silly mistake, because really, if he had simply been laid on his side, we wouldn't be here right now. The nurses weren't communicating in their charting and in their handover report. Now being a much more savvy hospital mom, I know that there are so many ways of communicating information. Much later, when some interviews were done, we found out that a couple of the doctors weren't even aware that Spencer had had 2 previous life-threatening episodes. There were a lot of external influences, I think, that were distracting people from doing what I guess they're supposed to do or what they would normally do, which is communicating with each other. We had a doctor going on holidays. We had an intern. We had a doctor it was the very last day of his locum when he saw us. So there were all these external things that were sort of causing this lack of talking to each other, collaborating, finding out what's going on with this child. He was handed off so much, and charting was being done later after people were reading the chart. So there were all these issues of information not being passed along. I think that if people would have talked to each other and worked as a team, rather than separate groups of individuals taking care of our child, I don't think we would have had the same outcome.